Okay, so thanks very much, Kathy, Christina, Shirley, for inviting me to give this talk, and thank you all for attending. Give you a little bit of a background on myself. I've been working in the field of digital imaging for the last 15 years. I'm a professor here at the University of Waterloo in electrical and computer engineering. And this project that I'm going to talk about is something that we've been working on probably close to 10 years. Although it's only now it's become in the form that you see it. So the talk is titled Bending the Cost Curve Towards a $1,000 Digital X-ray Imager for Scalable and Sustainable Healthcare. I'll explain how exactly this is going to occur. The motivation for this work is recognizing that diagnostics, or more specifically medical diagnostics, it's essentially a pillar of effective healthcare. Okay, if you don't have good diagnostics, well, you have a hard time figuring out what's wrong with patients. Now, diagnostics, in a large part, especially today, is driven by technology. Okay, diagnostic technology, various things: ultrasound, heart monitors, X-ray imaging, so on and so forth. And technology, by default, is always a cost driver. It drives the cost up everywhere, especially in healthcare. Why does it drive the cost up? Well, you've got expensive equipment. So if you build a new ultrasound, you've invested a lot of R&D into this, and you want to recover that cost. Well, that's going to be part of the reason why it's more expensive. You've got regulations that govern the use of this technology in the field. Well, that's going to be a cost to overcome that hurdle. Businesses that have set up, like medical companies like GE, they're very large businesses. They have business models that involve service plans, specific things that actually end up making the equipment very expensive. Now, expensive equipment is just one part of the story. What also drives up cost are the facilities, because if you're going to have a $200,000 piece of equipment, you're less likely to leave it in any old facility. In fact, small facilities would have a hard time affording a $200,000 piece of equipment. So they pretty much sit in hospitals. And hospitals are expensive to operate and run. And we kind of know that, right? Because small towns don't really get good hospitals, but large cities do. So there's been some sort of urban-rural split in healthcare where, because of the population densities, urban areas happen to have the hospitals and the treatment, and the rural folks have to make their way out in the urban area. And then the other thing that drives up cost is the labor, because doctors are very expensive. They're a cost driver as well. If you look at a diagnostic technology, well, you've got to have the equipment, you've got to have a place to put it, and you have to have somebody to interpret the result that comes out. If you put a doctor in Listowel, that could become very expensive very quickly, presuming the doctor wants to work in Listowel, and I'm sure there must be some who do. So put all three things in, you've got something that over time drives your healthcare cost up. And we hear a lot about this, that healthcare costs are unsustainable. Well, this is kind of why. So for this talk, I said, let me focus on something that I'm familiar with, something that I've been working on for a while, that's X-ray imaging. X-ray imaging is a gold standard for medical diagnosis of disease, and this is globally. Okay, so in North America, we might use X-ray imaging for cardiac, gastric disease, for cancer, and in the third world, they'll use it for tuberculosis, they'll use it for pneumonia, chronic obstructive pulmonary disorder, pneumothorax, and then obviously fractures. So X-rays are very, very prevalent and used, and I would almost say indispensable with modern medicine. Now, what are the options that exist for X-ray imaging? You've got things like film screen systems. These are the ones that were originally put into place. I call it circa 1896, but that's really it's a tongue-in-cheek reference to when Röntgen came up with X-rays, but they have been around forever. These things cost the least to purchase because really it's nothing more than an X-ray source and a bit of film. But the point is, the ongoing cost is very high because you have to have developer, you got to make sure that the film, well, it's a consumable, so you got to replace it, you got to have air conditioning in your facility, otherwise the films don't work. So it actually ends up being very expensive and very, very labor intensive. You can use computed radiography. These are filmless X-rays. They came out in 1975. These things are like photocopiers, but with X-rays. So you have a screen that's reusable, and it takes an image, and then you stick it in a photocopier, and you get an image out. The cost is medium to purchase, and the ongoing costs are also around the same. And then you've got digital X-ray, which is kind of piggybacking on the revolution of digital cameras, which we're all familiar with on your cell phone. The only catch with digital X-ray is the purchase price is very high right now because of the costs of R&D, monopolies in the manufacturing chain, so on and so forth. But the good news is the ongoing cost of digital is very low because you don't have developer, you don't have photocopiers, you just have a digital camera. And we know digital cameras are very inexpensive unless you insist on printing out the X-ray every time. But nobody really does that. Most of us keep our images on our camera or at home. We don't really walk around with thousands of photos anymore, right? And it also has the best quality. But I guess the one common thread between all these three methods of acquiring X-rays is that the lifetime cost for all of these is very high. It's just high. Okay? So you still have the same problem. You say you've got new technology, it's better, but the cost never came down. Because the cost never came down, the accessibility always remains a problem. You go to a hospital in Lister, well, they still can't afford a digital X-ray because it's $200,000 to put in a system like that. So therein lies a real challenge, right, and a real need. Now here's what a digital X-ray system looks like. There is an X-ray source, the patient, there is the X-ray detector, the camera, so to speak, and a computer that shows the image. Now this X-ray camera is not like a regular cell phone camera. Just so you get the perspective, it's very hard to focus X-rays. So typically what they do is they'll make the camera the same size as the object that they're imaging. So if you're imaging a chest, then the camera needs to be just as large. All right? So that's your X-ray detector. That's the expensive component. That component typically will run upwards of $100K. Okay? And if you're looking for some specialized versions of it, it can go even higher. Certain commoditized versions, it becomes a little lower, but in general, it's very expensive. What do? What is our approach to this problem? Well, we said, let's come up with a digital X-ray camera that gives you low dose, so patient safety is paramount, low manufacturing cost, we can drive the cost down, and can do video and still imaging. And that's essentially what we've developed here, a technology that actually does all three. You'd say, how do you actually do all these things? And I'll explain that. Over the years, remember I've been working in this field for 15 years. So over the years, we developed two, I call them pillars of this technology. One is the sensor and one is the readout. The sensor, we finally developed an X-ray sensor that can be built using standard display technology. And what I mean by display technology is the same technology that sits in your cell phone, that screen, you know, that screen in your cell phone. We've made an X-ray sensor using that same technology, using standard components, not changing anything. So in fact, we could go to a display manufacturer today like Samsung or LG and tell them, we've got a technology that just requires a reconfiguration of your existing layers, but essentially the same process. And they say, okay, well, we can do that. And we've spoken to that. So that's one. That actually drives your cost down and pushes your reliability up. Because you're using a well-established process, displays is a huge market, now you've been able to piggyback on that. And the second one is we've put amplifiers in our readout, which is something people typically don't do because the material is amorphous silicon. Amorphous materials don't lend themselves to amplification. They just have a lot of challenges. But we managed to build amplifiers in it. And what the amplifier lets us do is it helps us improve the signal-to-noise ratio, and that allows us to drop the X-ray dose for certain applications. Okay? So that's basically what we've done. Now, if you want to know more about it, we've got a poster that you can look at. But to close the loop, right? Let me close the loop that I started. I said $1,000 X-ray imagers for sustainable healthcare, for scalable healthcare. Here's what I mean. We said diagnostic capability is critical. What we're saying is if you can make a low-cost digital X-ray imager like the one I just described, and we believe that we can drive the cost down to even $1,000 in manufacturing, now you've dropped the cost of the equipment. Well, what's that going to get you? Well, it's so cheap, hospitals don't have to be the only place that keep it. You can now put these things into clinics. So you can have a distributed method of diagnostics. And you say, well, okay, you've distributed the X-ray imager, but you still need people to read the X-ray. You need doctors. But that's where telemedicine and the internet kicks in. That infrastructure already exists. We've got telemedicine, we've got the internet, we've got teleradiology. So if you could actually drop the cost on the detector, you could get a whole cascade of effects. And that's how I think we can actually make sustainable healthcare. Thank you for listening. I can take one question. Yes.
Excuse me, what about the source of X-ray?
Yes.
Let's say, yeah, my cell phone is a sensor, so what about the source?
The source of X-rays is typically some kind of an X-ray generator. Now those X-ray generators come in a variety of classes. You've got something known as a stationary anode X-ray generator, a rotating anode X-ray generator. Regardless of what X-ray generator you pick, it depends on where you're putting it. If I'm putting the X-ray generator in a high volume hospital, say like in Toronto, I need an X-ray generator that can continuously generate X-rays. So the price of the generator goes up. But if I put an X-ray generator in a town like Listowel, and I keep going back to it, it's my favorite town. If I put an X-ray generator in Listowel, I don't have a big population. I know I'm not going to have thousands of people rushing to take X-rays daily. I can put in a low volume generator. I can pick something like a stationary anode, and that stationary anode generator today, you can probably buy one made in Korea for about $4,000. Okay? That's not very expensive. If you look at the panels are 100K today. The generator is only 4K. So that's an important consideration. Thank you for asking.